The closing of schools is a very difficult decision. A lot of children are receiving breakfast and lunch at school. Then if the kids are home, what do the parents do? If the parents are home, who's going to be working in my hospitals? Which is the critical system in all of this.
Governor Andrew Cuomo there making the case against mass school closures in New York as more cities and states protectively cancel classes to prevent the spread of coronavirus. Joining me now to try to make sense of it all, former Homeland Security Advisor and ABC News contributor Tom Bossert, ABC News Chief Medical Correspondent Dr. Jennifer Ashton, and ABC News Chief Business Correspondent Rebecca Jarvis. Dr. Jen, I can just pick up right what we heard from Governor Cuomo there, making a case, and he went on even more than what you heard there about the downside of closing schools, and yet we see so many other school districts closing down. What is the right approach here?
You know, that is a complex question, John. He's right to consider all those other factors. When you hear things like school closures or people asked to work from home, not everyone has the capacity to do that. There's a domino effect with the operationalization of that kind of response that is complicated and intricate. What we do know is that it's not just about protecting school children. The good news in this outbreak so far is that children tend to be relatively spared in terms of symptoms of coronavirus, but that doesn't mean that they can't go on and act as vectors of spread and spread to other people. So this is part of aggressive social distancing. It's hard to shut down communities and regions without closing schools, though, and that's really the problem here.
So, Tom, the other thing we have seen just today is we've seen these images at airports, Chicago O'Hare and other airports, of long lines, people packed together because they're doing some screening now for symptoms of coronavirus. But, I mean, don't those lines create other problems?
Absolutely. So let me address that school point really quickly.
Yeah.
There has been a lot of study and research gone into this. So while I understand the mayor's point, let me be very clear. It's not about every city in this country. It's about cities that have enough cases to merit this decision.
Like New York City.
New York City merits that decision. He must get past that. He has no data. This thing drives me crazy. There's data to suggest this recommendation. He has no data to support all of his anecdotal concerns about what could happen and what couldn't happen. We know how many kids get school lunches. We know how many parents have kids in the healthcare system, and we can regulate that data. We can answer his questions. But he, in the meantime, while he makes these assumptions, is wasting time. I think he's been doing a very nice job leading New York through this process. I don't think it's too late. I think the mayor deserves a lot of credit, but I would urge him, and not to get caught into this 8-week delay discussion with the CDC, to take steps to notice people, to get them planning so that he can close that school system down. If in 2 weeks
it's the largest in the country.
If in 2 weeks he was wrong, he can reassess. Buy yourself more options. If you wait 2 weeks and regret it, you don't have any options. So
and the
open
lines
up
at the airports?
Lines at the airports, you know, if I were recommending these actions to the president, I would have said you're going to get a limited health value out of these closures to Europe, and you're going to have a massive economic consequence. The whole trick to what we're trying to pull off here is to increase the safety to people's lives and decrease the pressure on our hospitals without wrecking our economy. And at this stage, given all the exceptions to those travel restrictions, I think that we're probably blocking more people from those countries than we are a virus.
So, Rebecca, I want to get to the markets with you and whether or not we're in a recession. We heard the Treasury Secretary say that he does not believe we're in a recession and we're going to recover soon. But first, the practical question, these supermarkets, these empty grocery shelves, there are challenges to the supply chain. How long does that last?
Well, frankly, it lasts as long as the grocers stay open and also as long as the length of this crisis, the actual health impact of this crisis lasts. But I want to be clear. I've spoken to a number of vendors and grocers, and the supplies exist. It's just getting the supplies into the grocers, into the retailers at this point in time. And they are having to completely change the way that they do business. Rather than going from factories to distribution centers, then to stores Stores are now saying, bring it directly from the factory to us. Rather than getting 2 shipments a week, they are saying we need trucks on the road every single day, bringing us updated supplies. They are also limiting the amount of supplies that people can purchase at this time. And I have to say, there are a lot of retailers that have online presence. If you can purchase it online and pick it up in store, they are recommending doing that. That will allow for greater social distancing, so you're not part of that rush in the grocery store itself, John.
And what was your take on Mnuchin saying that he does not think we're in a recession?
Well, there's no doubt that there is a giant gaping hole in the economy right now. You can't cancel Disneyland and the NBA and March Madness and every other business shutting down, at least for the time being, without a substantial economic blow. And Mark Zandi at Moody's Analytics, the chief economist there, estimates that this will eat into, at a minimum, GDP $120 billion. There's also the ripple effect and the effects that we still don't know. We don't know how long the disease will be here. We don't know how the consumer will respond. And frankly, we don't really know what the long-term government response to this is and what kind of full stimulus package might be put together. Those are all unknowns that will lead to a greater or a lesser economic challenge for the country. And one other additional aspect I would add to this, I covered the Great Recession. I was here throughout. The economy, we didn't know that we were in a recession until a year after. It wasn't official that we were in that recession until a year after it had started.
So, Dr. Ashton, the other question is whether or not the medical system is prepared for all this. What is your sense? I mean, are they prepared for the onslaught that appears to be coming?
We don't know what the U.S. crisis surge capacity is in this country, John. It has never been tested to the magnitude of the range of worst-case scenarios that you discussed with Dr. Anthony Fauci. So I can tell you that as of Friday, with the authorization that the president gave for hospitals to enact their emergency preparedness plan, right now, every hospital, particularly in those cities that are experiencing high numbers of coronavirus cases, they are activating their disaster plans, which, to be clear, has to do with supplies, space, systems, and staff. And when you talk about staff, just one part of that, you're talking about looking at things like bringing in retired nurses, respiratory therapists, physicians, actually recruiting some volunteers from the community. When you talk about space, you're going to see looking at hotels or schools that are closed, or convention centers, community centers, in case they need to house large numbers of patients. We have never implemented a response along that level. And so right now, that is the concern. And that is precisely why when you hear aggressive social distancing measures and steps like Tom was referring to, that is so critical. If our hospitals get tested to that extent, we have to remember, people are still having heart attacks. People are still having strokes. People are still having accidents. Those people still need care. And when you start to see an implementation of what we call a reverse triage, where stable patients are discharged or moved to other facilities, that's a serious situation that we have no idea how it's going to unfold.
All right, Dr. Ashton, Rebecca Jarvis, Tom Bossert, thank you all very much. We'll be talking more in the days ahead.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.